Good afternoon to all of you.
Yes, good
I'm
afternoon.
Sheila Clanor from the Lyceum of the Philippines University, Batangas. And I'm here to present our research, the extent of the implementation of the AOH program for teenage pregnancy. Okay, teenagers were said to be the future of the next generation. But with the growing issue that the Philippines is facing, which the main cause were the youth or the younger generation, the image of the younger generation have been greatly affected in general. If the assembly happened last 2014 at the National Summit about teen pregnancy, where the National Youth Commission talked about the adolescent sexual and reproductive health, which became the defining issue for the Filipino youth. Furthermore, the Philippines is facing a national teenage pregnancy crisis, where a data from the Philippine Statistical Authority revealed that in every hour, there were 24 newborn babies from their teenage mothers. And being in the teenage phase of life and finding out that one is expecting a baby, especially if
Maria, can you move the slide?
can I share I'll be the one to move the slide.
Oh, no. Right now, the slide is shared by us. You need to share. If you need to share your slide, you need to inform us. And you need to share the screen.
Okay. So how can I manipulate?
Yeah.
Okay.
Okay.
So being in a teenage phase of life and finding out that one is expecting a baby, especially if the pregnancy is unintended and not wanted, can put enormous stress on an individual and to the family. Teenage pregnancy, one of the common social problems that are not resolved in many countries, including the Philippines, occurs with the ages from 13 to 19, and it can affect the physical, emotional, social, psychological, and spiritual balance of teenager who become a parent at a very young age. Teenage pregnancy results to take away the time and opportunity for a girl to savor the phase of being a teenager without any other responsibilities but to take care of her body and her own future. Since a pregnant woman has the responsibility to take care of her child, schooling may be stopped and landing in a good job during pregnancy may be consequently difficult. Okay, then next slide, please.
You can control it by yourself, Maria.
Okay. How can I control it? You are the one sharing the... So the City Health Office record. According to the City Health Office, there are 826 cases of teenage pregnancy in Batangas City from year 2015, where in every barangay there are cases among teenage pregnancy and the lowest was at 10 years of age. On recent years, Commission on Population stated that there is a strike of rise of cases of pregnancy among adolescents in the Philippines, from 1,700 cases in the year 2014 to 1,986 cases in 2015. In order to minimize the increasing cases of teenage pregnancy, programs are implemented by the government and non-government organizations. Some of these programs are widely implemented in barangays, in schools, and in the city. Programs such as health teen kiosks, which are built within the school premises, reproductive health and sex education, health education in schools, adolescent health and development, adolescent youth and health development programs, information education campaign, Babaenihan campaign, forums and counseling on teenage pregnancy and the reproductive health law. According to studies, the government have been putting an effort in promoting programs that might help in ending or at least decreasing the rate of early pregnancy cases among teenagers. But despite the efforts of the government and the behaviors of the teenagers, the program seems to be ineffective as proven by continuous increase of the teenage pregnancy cases here in the Philippines. The researchers strongly believe that in a small little way, the study become an eye-opener to at least remind teenagers the effect of pregnancy at a very young age. The study has the objective to find out the extent of implementation of government programs towards prevention of teenage pregnancy in Batangas City. Specifically determines the prevalence of teenage pregnancy for year 2016 to 2019, assess the implementation of government initiative towards prevention of teenage pregnancy. And based on the finding, the proposed program was made and enhance the initiative towards prevention of teenage pregnancy. Okay, so the researcher utilized the simple descriptive method of research, and the researcher used a self-made questionnaire. Descriptive statistics was used. The participants in this study were teenagers from 16 to 19 years old who experienced teenage pregnancy and those who live in the identified top 10 barangay with the highest number of teenage pregnancy. So as a result, all programs initiated by the government to prevent teenage pregnancy are all moderately implemented, and the highest among program is health education to high school students, and the lowest among the program is the teen health kiosk. Okay? So the highest, which is health education to high school students, because on their curriculum it included the health education, and then the teen health kiosk, only 2 secondary school in Batangas City have this teen health kiosk and 1 for the tertiary hospital. So the proposed program to enhance implementation and initiative towards prevention of teenage pregnancy. First program is information dissemination and development of IEC materials such as teen leaflets or flyers. And so the activities will be distribution of leaflets to different high schools in Batangas City, including the Barangay High School. And then the expected outcome, the target number of schools distributed with flyers will be met. Another program is use of social media. So create a social media account page specific for awareness and prevention of teenage pregnancy. And the expected outcome is there is an increased number of followers in social media account. And the last program is coordinate with the staff of Barangay Health Center. Okay, providing a copy of the study to barangay health workers. Okay, and the expected outcome is the enhanced barangay health center program towards prevention of teenage pregnancy. For our conclusion, first, teenage pregnancy in the areas of Batangas City is prevented in areas where programs are implemented. Second, despite the availability of programs implemented by the government to address the problem about teenage pregnancy, in 2016 to 2019, the rate of early pregnancy is still increasing in numbers in some areas. And the third, the proposed program may enhance the program implementation of government agencies to increase the awareness about prevention of teenage pregnancy. For our recommendation, based on the established conclusion, the researcher recommend that the program should be modified and are prepared through intense process for more effective initiation and easy access to teenagers. First, the proposed program can be utilized to promote the awareness in the prevention of teenage pregnancy. Second, empowerment of barangay health workers and others healthcare facilities in program implementation through trainings and seminars. Third, allocation of sufficient budget for the implementation of programs that is connected to teenage and adolescent health and wellness. Fourth, the barangay health workers may involve the parents and female adolescents through seminars and counseling. And the last is monitor of compliance to reproductive health programs undertaken by private and public schools. So teenage pregnancy, we have to know everything about it. Thank you very much for your time.
So, any questions? Oh, no? Any question from the floor? I'd like to ask you, I don't know, this may be the nonsense question. Many countries now, they are aware of the low growth rate of the population, especially people do not want to get married, do not want to have the family at all. Yeah, and they have a problem of they don't have the child. Is that the same thing in Philippines?
Is that what? Is that the last statement?
Oh yes, is that the same thing occur in Philippines, that people don't like to get married, don't like to have kids, don't have anything, but you may have something like this. They have the early pregnancy in the they can compensate for the for the low growth rate.
Okay, so because that's one of the problem. That's why there is still increase in the number of teenage pregnancy because we are a Catholic country. Okay, most of Philippines is a Catholic country, and then we believe in the sanctity of marriage and then the family. So even the reproductive health bill here, the contraception, the use of contraception is being not not being advocated by the church. So here in the Philippines are still growing and growing in numbers. Okay, so and the other the literature I put here in the research aside from the teenage pregnancy, because this is the multiple partners, okay, because of being a teenager, and then the curiosity. So the population here in the Philippines is still growing and growing.
So they believe in church rather than believe you.
Yes, because they believe that children is a blessing.
Okay.
The Filipino has a culture that the children can uplift their financial status if the children can help the parents to work and then aid for all the financial problem, all the financial aspects. So that's it.
Okay.
What is the DOS program?
Yes, ma'am.
What is the DOH program?
The
Oh,
DOH program. Okay, so there are several DOH programs, as I have mentioned. We have the Teen Health Kiosks, and then you have the Baba Anihan campaign. Okay, so we have the reproductive health and sex education, the health education in schools, okay, adolescent health and development, adolescent youth and health development programs, okay, and then the forum and counseling on teenage pregnancy and reproductive health law. So there are several programs by the Department of Health, but the implementation is based on the study is moderately implemented.
Okay.
thank you.
Okay. Thank you very much
Thank you very much.
for your nice presentation.